Good afternoon. I'm Mike Knight. I'm the Assistant Director of the Department of Behavioral Health on behalf of Dr. Veronica Kelly, who is on a much-deserved vacation. So today is our update for our contract providers, and we wanted to talk about a couple of things that will impact providers moving forward. So the first item that we have is not so much of an impact to providers as it is more of just information for providers. As most of you know, at the end of July, our Deputy Director of a long time here in the Department of Behavioral Health, Andy Grucci, retired, and he will be missed. He has served the department in a fantastic capacity over the past 25 years, and we've appreciated all of his work. Moving forward, we have asked Dr. Tim Haugen to step into Andy's place, and he will be taking on the executive leadership role over outpatient clinics. He will also keep all of the specialty children's services and TAY services. We have asked for Dr. Oglesby. He will continue to keep the forensic services, and we have opened a new deputy director position specifically for substance use recovery disorder services. So that position is currently being filled, and hopefully we will have a candidate in that position in the next coming weeks. We're excited about that prospect. The next position that had some significant changes was over the Office of Equity and Inclusion. So Maribel Gutierrez remains our Cultural Competency Officer. However, we have added a new Program Manager 3 over that entire program, and they will also take on the Clubhouse Expansion Program and all of the Mental Health Services Act administrative programs. So we're excited to fill that position and want to thank Maribel for her continued leadership in that role. There have been a number of other various changes, most of them which will not impact the contract providers in any great way. But just for context, I was, as the assistant director, was overseeing Office of Information Technology and Facilities Project Management directly. Both of those programs have been transferred out. So Office of Information Technology has been transferred over to Marina Espinosa, and the Office of Facility and Project Management has been transferred to Erica Ochoa. I have taken on the role of executive leadership for all of the homeless services programs. Another notable change is Dr. Georgina Yoshioka has taken over executive leadership over the ARBEST program. So we're excited about those changes. Other than that, those are all of the changes that have been made with regards to our executive leadership. So the next major topic of discussion has obviously been COVID-19 and the public health orders that have come down from the state with regards to COVID-19. So the first was public health order from July 26th, 2021, and the next was public health order from August 5th, 2021. So in the last update that Dr. Kelly gave, which was posted on July 29th, 2021, we actually went through most of the public health order that was available. And she gave a very good overview of all of the impacts of that public health order. That public health order, again, of course, ensured that all staff that were working in healthcare facilities, of which behavioral health care facilities were included, were required to either show proof of their vaccination status or get tested specific times a week, depending on the facility in which they were providing services in. The next public health order that came out on August 5th required that by September 30th, all staff that work in healthcare facilities were required to have completed their second dose of the vaccine by September 30th, 2021, which means that this public health order will apply to our behavioral health partners. So those of you who are contract agencies who are providing behavioral health services in our community, if you have clients coming into your facility, it is considered a healthcare facility. We are going to provide the link for both of those public health orders, but it is important to note that both public health orders are going to be going into effect. The first public health order goes into effect as of today, the date of this taping. It goes into effect, and we will be monitoring for what in the next steps with regards to implementation of that order will be. As of today, we have issued testing kits from the county to all of our county sites. They will begin doing their testings this week or providing proof of their vaccination status. Over the next couple of weeks, we will be reminding folks of our next and our upcoming vaccine events. We have been having those events since through the emergency use authorization of the vaccines through now. We continue to have those events, and we will continue to provide vaccination events for both contract providers and for staff, for their family members, whoever wants to walk in on a walk-in basis or schedule a time to come in for those vaccines. We will be notifying you all by email about when those vaccination events will take place. As of the taping of this message, press reports have indicated that just a few hours ago, the Pfizer vaccine was approved for full FDA approval. So we hope that the department can continue to offer vaccines moving forward, including the Pfizer vaccine. With regards to implementation of all of these orders, it is expected that the public health orders are followed by the facilities and the programs in which they regulate. But from the department's perspective, as we are implementing these public health orders, we will expect that our contract agencies do the same. At this point, there is not a specific individual compliance plan that we will implement to ensure that our agencies that we contract with are implementing this public health order. However, it is expected that you read and follow the public health order, which requires you to gather and hold information and provide that information if it is requested from both a county or state agency in order to show that you are in compliance. We thank you for all of the work that you all have been doing. We thank you for your continued support through this pandemic and through all of the work that you do on a day-to-day basis. We appreciate you, and we'll catch you on the well side.